Hello everybody, my name is Dr. Adnan. I have a patient with me called Madina, and she's came to me for consultation for a revision rhinoplasty. So we will talk to Madina about her journey so far in terms of plastic surgery and hear from her what she doesn't like about her nose. So tell us, Madina, why you want a revision rhinoplasty.
Well, I already had previously rhinoplasty, which is I'm not happy with the results, what I'm having right now. And I came to Dr. Adnan for consultation and to do revision.
So tell us about your nose. What do you specifically don't like about your nose that you would like me to change or address?
I don't like that it still doesn't look really naturally, and I don't like it's still wild. And
yes.
yeah, I would like to change the size of it and to make it a little bit more curvy and more natural, and which will suit basically to my face.
So fantastic. Yes. So any problems with your breathing at the moment?
Well, yeah, I do have sometimes breathing problems, especially when I do intense running or something.
Do you think the problem got better after your first rhinoplasty?
No, it got worse actually. Yeah, it got worse.
So Madina will be one of the many revision rhinoplasty patients that I address. I'll talk about Madina's nose a little bit for educational purposes. So Madina's got beautiful facial features. Her face is symmetrical and proportionate. She's got exceptionally good quality skin. Looking at her nose itself, I can see scars from previous surgery, and this external scar which happened at the time of primary rhinoplasty is also there. So this surgery was performed elsewhere more than a year ago. Looking at the symmetry of the face, I can see that the nose is more or less symmetrical in the longitudinal halves and the horizontal halves, which we do to assess the nose in terms of whether it's proportionate to the rest of the face. Now, the key things looking at Madina's nose would be the very wide nasal base, or what we call the bony vault, and she has a very wide radix and nasal dorsum. And that's with telltale signs of an open roof deformity, which wasn't closed properly at the time of primary rhinoplasty. The other thing to note in Madina's nose is she's got a very, very rigid tip, and there is some evidence of cartilage grafting on both sides, which are probably not in an anatomical position, so that she will require some tip refinement for that. And just look up a little bit more, Madina. If you look here, so there's some alar rim grafts, which I'm guessing in the wrong position, so they're herniating into the nasal cavity itself, and she's got very weak internal valves and turbinate hypertrophy inside as well. So all in all, to keep it simple, Madina is a good candidate for revision rhinoplasty. The goals of surgery would be to narrow the bony dorsum and the mid-vault, to narrow the bony base, do some tip refinement, and improve her internal valve, to improve her breathing. And this may well require cartilage grafting, either from the ear or a costal cartilage graft, so we'll see. Overall, we're quite excited about this procedure, and at the same time, Madina wants something done to her outer eyebrow, so we offered her an open lateral brow lift, but in the end we decided to do a direct brow pexy because the effect that she wants is minimal. So hopefully that was useful in terms of clinical assessment, and we'll follow Madina's journey throughout the surgery and after surgery as well. So this would be a journey you'd have to take with us.
I'm so happy, and I trust you completely, and I'm looking forward for.
That's fantastic to hear, Madina. We'll do our best for you. Okay.
Thank you.